Good morning. I'm Lauren Meffin, speech language pathologist. And before I head off to the clinic today, I wanted to talk with you a little bit about lymphatics for the head and neck speech pathologist. So, as speech therapists, we really have zero training in our school on this whole concept of the lymphatic system. But then we decide, hey, I want to be a medical speech language pathologist. That's what I want to do when I grow up. Yeah, I want to be a speech pathologist. Okay. Now I'm out into the clinic and I see my first head and neck cancer patient. And all of a sudden, I'm like, what? What's that swelling? Oh, I think that's cancer. Oh, let me talk to the ENT. Oh, I think I'm going to go tell them I found cancer. So I talked to the ENT. I look like an idiot. The ENT or the radiation oncologist explains to me, actually, Lauren, you're very wrong. And you maybe should consider a different job because that's lymphedema. So I started to hear this word around 10 years ago as a speech pathologist. And it was very overwhelming. But what I'm hoping to do is start to break this whole idea of what in the world is lymphedema from the perspective of an SLP down. Now, let's start off with a little bit of history about lymphatics. So it didn't just start 10 years ago. We didn't, in the medical world, decide, okay, lymphatics pops up out of nowhere. No, they actually found it 460 and 384 BC. So Hippocrates and Aristotle, they were all onto something. They were sort of thinking, okay, there's this fluid that seems like I can move. And that continued for years in medicine. And then in 1896, Vater was born, and he was a Danish physician. And he started to see that, if I massage these things, only I'm not allowed to call it massage, because if you call manual lymph drainage massage, then you are truly not a CLT. So I had to learn this kind of the hard way. My training was through SLPs, PTs, OTs. And one thing I learned is you're not allowed to call this massage. Okay, so just don't do it. Just don't do it. I'm still trying to remember I'm not allowed to call it massage. But what we're doing is if we stimulate a lymphatic system through touch, then that lymphatic system or those lymph fluid can be moved to other areas of the body, AKA your patient's swelling will go down. Okay, so later came Foldy. Dr. Foldy decided that there's more than just MLD, okay? There's a complete decongestive therapy. This complete decongestive therapy included 4 components, all right? MLD, which is movement, manual lymph drainage, not massage. Compression, that's a whole nother area we are going to talk about. Skincare, and decongestive exercises. So there's more to treating your patient than just moving lymphatic fluid. Now, Foldy continued to refer to this as the Vater technique, okay? So going forward, what is our therapy based on as speech pathologists? What in the world do we say, hey, this is what gives us the right to treat it? Well, our therapy is based on treatment of the deep lymphatics, the surface lymphatics, and then there's this really fancy word, lymphangioactivity. Now, I think it took me 3 courses in lymphatics to decide that I was comfortable saying that word, okay? But you have to be comfortable saying that word. So it's just a fancy word for contractile movement, all right? When we move lymph, there's improvements in the immune system of our patients. There's a diuretic effect. And those are very important to understand that when the lymph is moved, our patient has other benefits than just our touch on their body. That too is a benefit. So don't undermine your sessions and the ability of the impact you can have on your patient, okay? Now, so we're speech therapists, and we think we want to start to move into the world of lymphatics. And one of the things that we utilize is this technique, okay? So it's very important to know that when we touch and move fluid, the overall activity or lymphangio activity is improved. Lymph production is improved, but we must be gentle. This is not, as a manual therapist, a forceful movement. This is a rhythmic movement. You have to understand that if you don't follow those techniques, you can do more harm to your patient, okay? So there's a few other fancy words like hyperemia. And that essentially means that potentially, if we are too forceful, we can cause more harm or destruction to something called also anchoring filaments. Now, I'm throwing a whole bunch of words out at you that I have learned the more I hear fancy words, the better I get at them. So follow me and learn this terminology, okay? Now, one of the things is knowing that there's also 4 strokes that are taught in manual lymph drainage courses. But these 4 strokes share very similar things, okay? They share pressure is light, pressure is easy, pressure is gentle. There is a working phase, and that's where the clinician is guiding the fluid to the desired location. So for us as speech pathologists, we're taking the disrupted lymphatic area and we're mobilizing that sometimes from here up and over. It just depends where your radiation to your patient's lymphatics were. But there's a working phase that we're moving the lymphatic fluid and guiding it to the new desired location. Third, there's a resting phase. This is where there's a suction or a vacuum effect that the body naturally does. And lastly, you have to move your hands at a rate of 1 working phase per second, repeating that in 5 to 7 times in that specific area, okay? Now, you're sort of learning just some foundational principles this morning because you're debating if you want to become a head and neck lymphatic therapist, but you have to know there are some very specific contraindications, okay? So absolute contraindications are CHF, an acute infection such as cellulitis, an acute DVT, a renal failure, and potentially palliative goals might be a relative contraindication, right? So there's these absolute, I will not touch the neck, will not do MLD, and these relative that potentially I can sway my physician, my patient, that there are still some benefits. So please know that when your patient has an active malignancy, you need to consult with your physician to determine if what you can provide is more help than harm. Now for your neck contraindications, hyperthyroidism, cardiac arrhythmia, okay? We don't need our patient falling out on us because we decided to move some fluid around in the neck when they have an underlying medical condition that as clinicians, we don't understand, all right? Now a relative, sort of I can sway on this one, is closely monitoring your patients over the age of 60. Here, what you're ensuring is that you're not going to be moving plaque, okay? There's other things that occur in the neck. It's not just responsible for lymphatic movement. All right, you've got some arteries in there that you want to make sure you're not mobilizing things that don't need to be mobilized. All right, so a couple of things I want you to understand. I am going to bring you information through the eye of a speech pathologist and lymphedema. This is not information I made up. This is information that is a compilation of my training. My training started off at the Norton School of Massage for head and neck lymphedema with Brad Smith. My training then moved into ACOL's Academy of Lymphatic Studies, where I received my full CLT. That was with Marina. And then I continued my ACOL's management of the head and neck with Cecilia. I also remain up to date with literature, and I closely refer to the lymphedema management textbook by Zuther and Norton. So please understand that what I share with you is through years of education, years of training, years of hands-on movement. I continue to remain active in treating my patients so that I don't lose those skills. And I also am passionate about teaching other clinicians around the world, around the country, who feel like, I think I want to learn lymphatics, but you can't learn it through YouTube. You can't learn it through a podcast. So if you think you want to learn lymphatics, you need a hands-on mentor. You need a hands-on course. So don't overestimate my excitement with bringing to you lymphatics via the internet for a replacement, because it is essential you touch and feel the movement of the body, okay? So next thing, feel free to download your checklist, all right, for your contraindications in the link below. Continue to join me tomorrow as we learn more about the lymphatics through the eye of a speech pathologist. Have a wonderful day.